Ensuring global health security requires building a multidisciplinary workforce of veterinary, agricultural, environmental, and human health experts. In addition, expertise in social sciences, security, law enforcement, and artificial intelligence are essential to the One Health approach and global health security. A multidisciplinary and multi-sectoral approach is necessary to prevent disease and complex health threats, detect them as early as possible to reduce the extent of their effects, and competently respond in case of outbreaks. Working across such different professions and sectors is a new undertaking for many countries, especially in Africa. A competent One Health workforce is crucial to global health security and pandemic preparedness and response. Building the capacity of regional and national workforces in One Health competencies is key to achieving objectives of global, regional, and national health security instruments.
Public health in the past has waited for that moment for when people have become infected and then we react. What we have learned over the last decade is that if we want to be effective public health leaders, we have both the responsibility and the opportunity to ask ourselves, what can we do to prevent these diseases from emerging in the first place? And in our experiences over the last several years, what we have learned is that our ability to effectively intervene before these diseases emerge, what we need to have is a shared partnership with those professionals that are responsible for animal health, both in livestock and in wildlife, that the future direction of public health is to begin to understand its position within the larger ecosystem. Public health doesn't just begin by administering drugs to a sick person. Public health begins by understanding where there are opportunities for new disease threats and to work with those partners to prevent those diseases from emerging in the first place. One Health is about forging a partnership that invests in and strengthens the capacities of veterinary medicine to perform their responsibilities to provide a healthy livestock population. It's a partnership that is invested in the wildlife community to ensure that the wildlife animals have an environment and have the ability to survive and live in a system that is non-threatening. It is a partnership that is based on mutually beneficial opportunities, but it's a partnership that ultimately says we have to invest in our systems collectively. We have to have a shared vision that when we train the leaders in veterinary medicine for tomorrow, we train the leaders in public health for tomorrow, when we train the leaders in wildlife and in conservation for tomorrow, for us to be successful, they have to have a shared vision and a shared understanding that they are only going to be as effective in executing their responsibilities for animal health, for human health, as if they work together. And that we bring them together at ministerial level, we bring them together at the provincial level, the district level, at the community.
Africa One Health University Network, or Afrohun, is an international network of institutions of higher education in Africa. Afrohun membership spans the length and breadth of the continent in 26 schools of public health, veterinary sciences, medicine, pathobiology, and environmental sciences. These are located in 10 countries. Afrohun's core business is working to transform the training environment and approaches in training institutions in a bid to develop a workforce without disciplinary barriers.
Universities by nature are transboundary. That's why we are called university. So as an entry point into building this web of effort across Africa to cordon off the spread of germs, a university is a strong area of entry because universities work together across borders. We are in a position to create curricula. We are in a position to do research and surveillance. and draw an early warning system that can feed into the government efforts. Government efforts tend to be more national in nature than regional. So the universities are bringing that strength and advantage to bring the knowledge to flow quickly from country to country, and therefore help the national efforts of Ministry of Health, Ministry of Agriculture, animal industries, food security, and so on, to coordinate and build together. And therefore, the Africa-wide network has now become very strong to drive that agenda.
Afrohun has created capacity in the universities for lecturers, professors, to be able to teach in a multidisciplinary way, creating the environment that people or students, when they graduate, they're able to address One Health problems. At the in-service level, we have created a multidisciplinary committee, this multidisciplinary staff that actually face One Health challenges head-on. We have also involved the students at all universities and created the One Health student innovation clubs, which are very active, and they go into the communities to train and skill the communities. I'd like to encourage those who are not in One Health, whether they are universities, whether they are organizations, to involve themselves, to interest themselves to be part of us.
The multidisciplinary and multicultural training approach enables students to understand and appreciate the contribution of disciplines outside their own in predicting, detecting, and responding to the kind of complex health challenges we are witnessing today. This is the next generation workforce that we need in the face of increasing outbreaks of epidemics, pandemics, and complex health challenges.
My involvement in several One Health activities during my undergrad, I participated in volunteering activities whereby I went to the community and I actively engaged with community members in providing awareness and education on One Health in aspects such as rabies, antimicrobial resistance. So this engagement paved a way to me, and I realized I was more engaged into the community in prevention of diseases, and I had an interest. So I realized the correct path for me is public health. So when I was done with my medical degree, I knew for sure what I want to pursue, and I started applying for scholarships and masters. And the volunteering activities that I involved in my undergrad and the leadership position that I had in SOIC solidified my application for the scholarship and made me be awarded the Mandela Rose Scholarship that I'm now onto it.
Je vais l'aborder en 3 phases. Je parle de avant, pendant et maintenant. Et comme je le dis, j'ai adhéré au club, disons, j'ai adhéré à Afrohun Une Santé lors d'un hackathon. Je suis simplement venue pour voir si réellement ça peut fonctionner. Voir les étudiants venus de différentes facultés se réunir ensemble, défendre, encore parler d'une même cause. Pour moi, c'était impossible. Et lorsque je suis venue, l'ambiance, le déroulement des activités, le mentorat en tout cas, pendant cet hackathon, ça m'a permis de comprendre qu'il était bel et bien possible de voir les étudiants de différentes facultés, des étudiants en pharmacie, en médecine vétérinaire, en communication, collaborer ensemble pour résoudre le problème de santé. Et juste après ça, des sites ont amplifié encore, m'a permis de mieux voir. Et après ces temps, j'ai pu organiser des activités fortes de sensibilisation parce que là, mon souci, c'était la communauté. Mon souci, c'était de voir un changement. Et je sais que je n'ai que la communication pour emmener la communauté à changer sa façon de voir les choses. Et justement, après, j'ai organisé des activités de sensibilisation, surtout dans des écoles. En tout cas, ma priorité, c'était de voir ces élèves en train de grandir, comprendre un peu le sens de pouvoir laver les mains correctement, de pouvoir sensibiliser, dire même aux parents, papa, maman, j'ai appris ceci, on m'a dit qu'il faut laver bien les mains après la toilette et tout. C'était ça mon souci. Justement, après, j'ai organisé des activités de sensibilisation dans des communautés contre la rage, la sensibilisation sur l'hygiène alimentaire et tant d'autres. Et justement après, Afrohun m'a permis d'avoir une bourse qui a vraiment contribué à ma carrière. Cette bourse parlait de la communication et nous sommes allés pendant 3 mois où nous avons appris ce qu'on dit souvent à l'université, comment concilier la théorie à la pratique. C'était ça ce que j'ai appris. Et je me rappelle bien d'un atelier très important, l'idée par le professeur Nadège, dans l'une de nos provinces, Nadège Kabamba, dans l'une de nos provinces de Kinshasa, encore de la RDC plutôt. C'était sur l'élaboration des outils de communication face aux maladies, aux 6 zoonoses prioritaires en tout cas. C'était des moments très capitaux où on a pu élaborer des messages de communication suivant chaque critère. Et maintenant, qu'est-ce que j'ai pu mettre en place? J'ai conçu une émission parlant santé publique. Mais le grand problème lorsque j'ai conçu l'émission, je me rendais compte qu'à chaque fois que je contactais les experts en la matière, le professeur, les scientifiques, les experts, c'est toujours, je n'ai pas assez de temps pour passer à la télévision. J'ai d'autres occupations. Je me suis dit quand même, vaut mieux recevoir les politiques sur mon plateau, comme ça on peut parler politique en République démocratique du Congo, au lieu de s'attendre aux experts, eux qui connaissent en tout cas la matière, et ils n'ont souvent pas le temps de pouvoir venir à la télévision. Pourtant, il y a une communauté qui est juste là en train d'attendre des messages importants venant des experts. En tout cas, là, c'était un grand problème. Et face à cela, je me suis dit, au moins, je peux prendre un plan B. Le plan B, c'était de faire des activités encore, des émissions sur terrain. Je fais plus des micro-baladères, c'est-à-dire, je descends dans la communauté, je prends par exemple un sujet, la rage. Je me rappelle dernièrement, j'étais à Kinshasa, mais c'était dans un quartier très très loin en tout cas, où la communauté, c'était vraiment un milieu rural. J'ai posé la question de savoir qu'est-ce que vous connaissiez par rapport à la rage. J'entendais certains dire non, c'est une maladie de noir, c'est simplement ce que le blanc a mis, ça n'a rien à voir. Nous, quand on est mordu par un chien, c'est qu'on fait, c'est peut-être mettre une sorte de cendre, tout, et ça finit là. Et après ça, qu'est-ce que j'ai fait? La communauté que j'ai pu sensibiliser, on se réunit ensemble et je partage au moins le peu de connaissances que j'ai en tout cas sur en la matière, parce que je ne suis pas docteur. J'ai dit au moins je communique par voilà, je parle lentement. Ok. Au moins je communique. Je sensibilise la communauté. J'ai dit à la communauté, au moins je sais que vous n'avez pas assez de moyens, mais au moins il y a un savon, au moins il y a de l'eau, vous pouvez au moins appliquer ça. Et justement après, aller dans un centre de santé le plus proche où vous verrez comment vous serez soigné. Ainsi, vous allez protéger vos communautés. Donc c'est un peu ce que j'ai fait dans ma carrière en tout cas, en ce qui concerne la santé. Merci.
Thank you so much, Priska, for that nice, passionate response. I think, Doreen, you wanted to answer this question as well.
Okay, thank you. So I will start by, with my recent job, at an interview, I was asked, what can you tell us about One Health? In my mind, even I just laughed. Because in 2012, I championed the establishment of One Health Students Club, and the knowledge I got about One Health was from one professor, Professor Majalija, who was then the focal person in Makerere University. So he kept on telling me that this might be a long journey, but we shall have to instill mindset change in all professionals to be able to appreciate the role of each sector. So having established the One Health Students Club in Makerere University, we were engaged in very many community service projects. For instance, sensitizing abattoir workers, and you would really see that communities appreciate seeing graduates going down there in the abattoirs to help them, sensitize them about zoonotic infections. Also sensitizing communities that are in agro-pastoral communities, corridors in Uganda. So with all this, we're able to increase the awareness and the knowledge even among students that they can have a role and contribute to preventing public health threats. Also, having led the Stop Spillover project, we engaged very many stakeholders at national level, at community level, and we established the One Health Dream and Research Mentoring groups. And these groups, you would really see that they appreciate the role of working together. So when I was asked that question, I think I got 10 over 10. Thank you.
To achieve this transformation requires curricular review, designing experiential learning multidisciplinary training programs, retooling teachers and trainers for effective delivery, educating communities on existence and transmission of zoonotic and infectious diseases, while engaging national and subnational governments to integrate One Health into national policy and strategic planning. One of Afrohun's most effective approaches to One Health competency building is the Student One Health Innovations Clubs, or SOHICs. The clubs are mentored, self-governing, self-organizing spaces, providing students with much-needed opportunities to network, learn from others, and develop new perspectives to professional development and practice.
These are student-led platforms which help to bridge the silos among students. These clubs started way back at the inception of the network around 15 years ago to help inspire students who work on One Health issues, really work on complex issues that cross beyond sectors and require different disciplines to address.
In order to deliver the new curricula with One Health content, Afrohun has invested in the retooling of faculty. Focus has been on curriculum review, content integration, instructional design, and e-learning. Over the years, Afrohun's impact on workforce development has been felt across the continent. Afrohun's pre-service training has reached thousands of students across Africa, fostering a new generation of One Health professionals ready to tackle global health challenges.
All of you working together have trained over 50,000 people around the world over the past 5 years. 50,000 people, that's a lot. And this in the face of a pandemic that really brought many projects, many parts of the world to a screeching halt. So there is so much to build on, there are so many successes, and I hope that we will all explore how we can do that with the Afrohun Academy as one of our real tools or toolboxes and platforms going forward.
As more and more of our programming focuses on engaging with local partners, Afrohun is a prime example of the type of local partner that USAID wants to engage with. And Afrohun is in a unique position to partner with our missions at the country level while benefiting from regional collaboration and economies of scale. And it's important to recognize that Afrohun has a key role in preparing current and future multi-sector workforces to coordinate and communicate across sectors through its activities.
With the creation of the Afrohun One Health Academy and working with different actors in the One Health space, the network is well positioned to support both pre-service and in-service skilling needs across and beyond the continent.